Hi, I'm Jim Gordon, editor of Wines and Vines magazine. Today I want to talk about the strong connection between wine and health. That connection has been confirmed again by the federal government's Centers for Disease Control and Prevention. The CDC recently came out with an amazing statement that moderate alcohol consumption is one of 4 low-risk lifestyle behaviors that can have a very positive effect on your mortality. In other words, how long you live. What's most amazing about this statement, however, is that almost no one thought it was amazing. It got minimal news coverage. I didn't even hear about it until the Distilled Spirits Council of the US issued its own press release about the study. The thing is, I've been covering the wine industry as a reporter and editor for 30 years, and I can tell you that a statement like that, coming from a federal agency and barely causing a ripple in the news media, shows how far our American culture has come. Remember, our country banned alcoholic beverages for more than a decade, beginning in 1920. Till the 1990s, it was politically incorrect to speak about drinking as a good thing in any way, shape, or form. Most people knew it was a pleasure, of course, but it had to be a guilty pleasure. Today, roughly 30% of US adults don't drink alcohol because their religion says it's bad or because their own views on health won't let them. So for a public agency to affirm so clearly that alcohol in moderation is good for you is a turning point worth celebrating. Here are the 4 healthy behaviors that the CDC says are associated with living longer. Having never smoked, eating a healthy diet, getting regular physical activity, and moderate alcohol consumption. We all knew already that smoking is bad and that a healthy diet and regular exercise are good. But now we also know that moderate alcohol consumption is in the same league as these other obviously healthy habits. The CDC study concludes that people who do all 4 of these things live 11 years longer on average than people who don't. This study looks at alcohol consumption in general and doesn't make separate conclusions for people who drink wine versus beer or distilled spirits. And the study keeps referencing moderate consumption. But what's the definition of moderate? We can look at the Dietary Guidelines for Americans 2010, issued by another federal agency, the US Department of Agriculture, for the official view on moderation. In a nutshell, it's 1 drink per day for women, 2 drinks per day for men. For wine, that's up to 5 ounces for women and up to 10 ounces for men, assuming 12% alcohol. However, if you like to drink full-bodied wines with today's more common alcohol level of 14% or more, then you should keep the pour at about 4 ounces. So I'd like to offer a 4-ounce toast. Here's to your health, or to be technically correct, I should say, here's to the positive effect on your mortality. That's good.